COVID-19 and mental health. MHA 575, Current Events in Healthcare, Southern Illinois University, February 27th, 2021. I'm Vicki Brown. During this presentation, I am going to give you some background information on the pandemic and the resulting rise in mental health issues. I'm going to be informing you on some statistics on mental health that were obtained through screening processes by Mental Health America and the Kaiser Family Foundation in the year 2020. We're going to review a few case studies referencing to mental health issues, and then I'm going to provide some information on recommendations to improve the infrastructure for the mental health and behavioral health system in the United States. The coronavirus pandemic that began in late 2019 in Wuhan, China, and rapidly spread throughout the world has brought with it a state of emergency internationally. All across the world, economies have struggled while people have been forced to give up some of their freedoms in effort to curb the spread of the infectious disease. Many Americans suffered financial hardship as a result of lost jobs, causing these people to have food and housing insecurities. Everywhere, people were forced to social distance, self-quarantine, and isolate. People have lived in fear of contracting the illness. All of this has taken its toll on the state of mental health, not only in America, but internationally. Not only is the pandemic affecting adults, but children who have been forced to do school virtually and are unable to see their friends have taken a hard hit. Pfefferbaum reports that some groups are more prone to suffer from mental health conditions due to the pandemic. She reports that people who contract the illness, the high risk, the elderly, those in congregate settings, and healthcare providers are at the highest risk of developing psychosocial issues due to the effects of the pandemic. Common emotional effects include anxiety, depression, insomnia, irritability, fear, confusion, anger, frustration, boredom, and the stigma that is associated with quarantining. Conflicting restrictions often caused even greater distress and made some become uncompliant with mandates. The rate of violence has increased over the course of the pandemic, and so has the rate of suicide. The pandemic has also made accessing healthcare services and mental health services much more difficult. Many clinics succumb to providing telemedicine in an effort to replace in-person visits. Even the most optimistic person has felt some effects and mental strain because of the pandemic. In 2014, Mental Health America began a screening process to address mental health in America and to evaluate the overall state of it. In 2020, that screen was accessed by 1,560,288 people. Those people took the screen, and the results have been astounding. The majority of the people who took the screen took specifically the depression and anxiety screen tests. 315,220 took the screen specifically for anxiety, a 93% increase over 2019 and comprising 20% of all screens done. 534,784 took the depression screen, a 63% increase over what occurred in 2019 and comprising 35% of the total number of screens performed. Greater than 8 in 10 who took the anxiety screen displayed moderate to severe symptoms, as did those who took the depression screen. Mental Health America also reported that 178,000 who took the screens had suicidal ideations. In the youth, specifically the 11 to 17-year-old category, there was a 9% increase in accessing the screen. This age group is found to be more likely to develop moderate to severe symptoms of anxiety and depression. In fact, 90% of those screened scored moderate to severe depression. Over half of those screened in the 11 to 17 category had thoughts of suicide or self-harm. 83% scored moderate to severe anxiety as a result of the pandemic. Of all of those screened for a mental health condition, 70% reported that loneliness and isolation was the cause. 27% said that the coronavirus specifically was the cause, and another 27% said that current events was the cause of their mental health deterioration. The Kaiser Family Foundation also performs mental health screening that is accessible to all. Comparing 2019 results to 2020 results reveals that there was a 273% increase in those reporting symptoms of anxiety or depressive disorders. In young adults aged 18 to 24, 56% of those screened reported symptoms of anxiety and depression. This age group was 25% more likely to report substance use than adults over 24. The rate at which those who had lost jobs reported mental health symptoms were 53% more likely to report symptoms of anxiety and depression. 41% of adults screened reported both symptoms of anxiety and depression. 42% of essential workers reported symptoms of anxiety and depression. This was up from 30% in 2019. These statistics are astounding and provide a glimpse into the severity of the state of mental health in America resulting from the COVID-19 pandemic. This is Christopher Aldine. In an interview with Phillips of Sky News, his sister Samantha reported that her brother succumbed to suicide due to the depression that he developed as a result of the pandemic. Samantha said her brother was a paramedic who had been working on the front lines of the pandemic in England. He was happily married and had 2 children. Samantha said that she could see his mental health deteriorating during the pandemic as it had put a tremendous strain on his mental health. He had no history of a mental health condition prior to COVID-19. During the interview, Phillips reported that the news station had been flooded with people who had commented on the story and provided their own information about similar suicides they felt were due to the pandemic. For Clark County, Nevada, the pandemic took its toll on school-aged children. Schools were shut down in March of 2020 due to the rise of the pandemic, forcing students to shelter in place at home and not be able to see their friends. For many students, school is a place where they can receive mental health services. Clark County, Nevada had a mental health warning hotline in place prior to the pandemic. After the closure of the schools, superintendents say that they saw a significant rise in the use of this hotline. Green reported that school officials had seen as many as 3,100 alerts from the warning system, a sign that the mental health of students was deteriorating. Clark County saw 18 students' suicides during their 9 months of closure. That was doubled from the prior year. The youngest victim was only 9 years old. Green reported that the suicides have prompted the school district to reopen its doors. One story that has gone viral over the past several months is that of Hayden Hunstable, a young boy, almost 13, who took his own life due to the anxiety and depression he was suffering from during the pandemic. In an interview with Bradford, Brad Hunstable, Hayden's father, talks about the nonprofit foundation he and his family started to help other parents recognize the mental health signs and symptoms that could lead to suicide and navigate the mental health system to appropriately deal with these issues. Bradford explains that a survey performed in 2020 of school-aged children found that half of them reported symptoms of anxiety and depression since the pandemic began. She further stated that the age group that Hayden was in, the 11 to 17-year-old category, had the highest report of the symptoms. Hayden's father reported that Hayden was just days away from his 13th birthday. His grandfather had been there that day to help with some repairs around the house when Hayden went upstairs to his room. Brad sent his daughter to get Hayden, and his daughter found him hanging in his bedroom. Mr. Hunstable tried to revive him with CPR, but his efforts failed. Many services that were available for mental health treatment have been cut short due to the pandemic. Pfefferbaum and North report that many services were transitioned to telemedicine due to restrictions that were put in place. Pfefferbaum and North also suggest that primary care providers address mental health with patients who are at high risk for developing anxiety and depression during the pandemic. Their recommendations suggest that primary care providers give patients suggestions for coping mechanisms and provide appropriate referrals for specialized treatment when necessary. Across the United States, some efforts are already being made to improve the infrastructure of the mental and behavioral health system. One such effort has resulted from the collaboration of the First Lady of New York City, Sherilyn McRae, and the former president of the National Council for Behavioral Health, Linda Rosenberg. The two ladies teamed up with mental health experts to develop a path forward, mental health and the United States pandemic response. The goals of their report include ensuring that mental health care is effective and is accessible and equitable for all, improvement of the mental health infrastructure to look at mental health from a population health viewpoint in order to be able to accommodate the long-term mental health effects of the pandemic, and to eradicate inequities that exist within the mental health care system. These efforts will require governmental support in the form of improved health policy and adequate reimbursement of such services across the continuum of insurance. Suggestions in their report are for the Center for Medicare and Medicaid Services to use their regulatory authority to eliminate cost sharing for mental health and substance use disorder treatments, as well as increasing Medicaid reimbursement for such services. They further suggest that across the nation there needs to be expansion in the certified community behavioral health clinics by providing greater accessibility to the services. Technology could also serve as an aid in improving the mental health outcomes by making apps and other technology to engage people to participate in therapy. A major factor made possible in state and federal initiatives, McRae and Rosenberg also suggest that all public schools be mandated to perform mental health screening of all students and ensure that students have access to counseling while at school. Teachers should be provided with education and training so that they have the tools necessary to address student mental health. They further recommend that all health professionals be provided training in mental health through funding from the Health Resources and Services Administration. Grant funding should be developed to aid professionals in building mental health programs and improving mental health competencies. In New York City Cares in 2019 was developed. It is a low to no cost healthcare program for low income individuals. Also developed was a social emotional learning curriculum for all of the public schools in New York. The goal of both programs is to have better mental health outcomes population-wide. In conclusion, the coronavirus pandemic has not only caused economic and medical catastrophe globally, but its toll on mental health will be seen far after the pandemic is over. It is imperative that the United States infrastructure for mental and behavioral health services become better funded and more accessible and equitable for all. School-aged children have taken a particularly hard hit, as evident by the increase in suicides in 11 to 17-year-olds. Services such as recommended by MHA and Rosenberg for improving mental health in the educational system could prove beneficial in reducing adolescent suicides. Primary care providers need to integrate mental health into their curriculum of care, and healthcare professionals should receive better educational training on mental health and behavioral health to improve their competencies in dealing with patients with mental health issues. Thank you for viewing my presentation.